Okay. All right. Good afternoon, everybody. Hello. My name is
Hey.
Lacey Dawson. Hey! My name is Lacey Dawson, physical therapist, wife, mother, and creator of Jubilee Mama Empowerment, which is a support group that helps to give resources to pregnant women and also moms of infants and toddlers from 0 to 3 years old. I'm here once again with an awesome presentation by someone that I've known for a long time, Miss Aleshia. Hey, she's going to be talking about postpartum realities, and then I'm gonna let her introduce herself, and then she'll go straight into her presentation. So, Alicia, go ahead, introduce yourself. Let us know who you are, what you do, your profession, how long you've been doing it, and why you love what you do, and why you're here today.
Okay. Hey, guys. Like Lacey said, my name is Alicia. We go way back from Stony Brook University.
Yes, we
But
do.
I have been a nurse now for 10 years, and 8 of those years has been involved in birth work as a labor and delivery nurse. I loved it so much that I decided to go into midwifery. So I'm in the final stages of that program. I go to NYU, and I was supposed to be done in May, but COVID happened. So I'm just waiting to finish up my clinicals, and then I can go ahead and take my board so I can be official. And beyond all of that, I guess one of the most important things that I have, to back up why I feel like I can talk about this kind of stuff is I have 4 kids of my own. And I've gone through vaginal deliveries plus C-sections. So,
All right.
I know a little bit about pretty much everything.
All right. All
Yes.
right. Awesome.
Yeah, so that's me. All right.
Awesome. Hmm.
You want me to go ahead and get right in?
Whenever you're ready.
Okay, we can do
All
it. Let's
right.
do it.
Okay. Let me add this in.
Hmm.
All right.
All right. Perfect. So, like Lacey said today, I'm just going to be talking about postpartum realities. A few weeks ago, she posted a poll and asked, what are some of the topics that you guys would be most interested in. And so, postpartum seems like a hot one. So that's what we're going to be focusing on today. The topics I'm going to be discussing are physical changes, sexuality considerations, breastfeeding, emotional changes, and lastly, realistic expectations. Please feel free to stop me, Lacey, if you have any
Hmm.
questions, and then we
Sure.
can get that going. All right,
Absolutely.
so first we'll talk about the physical changes. So, what are the common discomforts that are related to the postpartum period, which are like the first 6 weeks after birth? So we have tender breasts, sore nipples, abdominal cramping, perineum soreness, vaginal blood flow. Um, some women have difficulties urinating and their bowel function. A lot of women go through the extreme feelings of being tired, having a difficult time getting enough rest. And then, of course, if you've had a C section, you may have the additional consideration of pain at the incision site. So just to go through a few of them, some of the more common ones, we have sore nipples. So one of the most common causes of sore nipples is a poor latch when breastfeeding, and this usually starts about 1 to 4 days after birth. Some of the signs that you have a poor latch is the pain is worse when you start the feeding, and then gradually it starts to wane as the baby continues the feeding. After feedings, you may notice that your nipples are pinched or misshapen, which is indicative of the fact that they only have the nipple when they're feeding. You may also notice some cracking of the skin and even some bleeding. So, to help prevent and improve sore nipples, you want to make sure that the baby has a good latch. And to do this, you want to make sure the baby has a wide enough mouth, right, before putting the baby onto the nipple. And you
Hmm.
want the baby latched onto the areola, which is the darkest part of your breast, rather than just the nipple itself. And then you want your baby's tongue to be under the nipple and not over it.
Hmm.
And also, I highly recommend everyone see a lactation consultant, whether in the hospital. Well, you should see them in the hospital.
Right.
Some hospitals don't have them at certain times in the night. Um, and I know that most units are requiring that their postpartum nurses have a are lactation consultants. Like they actually go through a course so that they can help you as well. And then when you get home, you can also, I know some insurances actually cover at least one home visit from a lactation consultant. So that
Oh, okay.
would be awesome too. Yeah. They're
Okay.
helpful in correcting issues like a poor latch, um, you know, the proper holding techniques for babies, especially with C-section mamas, because they have difficulty sitting in certain positions in the beginning while they're healing. So they're very useful for those different things. Also, we have tender breasts, which I think every woman probably goes through immediately after birth, well, within the first 3 or 4 days. So, what happens is 3 or 4 days after delivery, your breast milk starts to transition from what we call the colostrum, which is like that thin liquid, almost looks like water, and it turns into mature milk. So, what happens is the breasts become heavier. Um, some women actually have this happen even on the first day. Everyone's bodies are different. But what tends to happen is that with this transition, your breasts become fuller and you may experience what we call engorgement. And this is when your breasts become tender and hard, more firm. So, what are some ways that we can prevent this? Is breastfeed when the baby wants to eat. Try not to have the baby sleep too long. If the baby is very sleepy, wake the baby up. When it comes to breastfeeding, you should be doing it about every 2 to 3 hours. Sometimes babies cluster feed, and you may find yourself feeding every hour.
Hmm.
But
Hmm. Right.
you don't really want to wait anything longer than 3 hours, because then your breast absolutely will be too full, and then you'll experience all of that pain. And anyone who's experienced engorgement knows that that can be very excruciating.
Right.
Um, and then what happens too is that sometimes if the breasts are too full and too hard, sometimes the baby may actually have a hard time latching. And
Hmm.
the number one thing that they tell women, right, is to feed the baby when you're engorged. But if you're too engorged and the baby won't feed, then what are you going to do, right? So what
Right.
you can
Right.
do is try to express some of the milk, hand express, or even pump, so that it can soften the areola a little bit more, so that the baby can actually get on. You want to make sure your baby is latched well, like I said before, feeding efficiently, and you should hear your baby swallowing. Also, we recommend that you use both breasts during feeding. So don't just solely rely on one breast for the first feed, and then 2 to 3 hours later you're doing the next breast. No, you want to do
Right.
some time on the left, some time on the right. And then if the baby is only feeding on one side and they're falling asleep, then what you may want to do is either hand express the other side or use a pump and express that. All right. What to do if they do become engorged? Things you can do are, like I said, hand express or pump. You can stand in a shower under a warm stream and massage it out in there. That is very helpful. Or you can either use ice packs or a cold compress on your breast, and that'll help to reduce the soreness between feedings. And if the engorgement doesn't seem to be improving, or your baby is just not feeding well from it, you definitely want to call your provider and see what they can do, because maybe you have a more severe problem, such as an infection or a blocked duct. And you want to make sure that you get a hand of that before it becomes a worse situation.
Right.
And
Right.
also, if you have chosen not to breastfeed, you're definitely going to experience some engorgement because you're not releasing the milk. So one way that we recommend is to put cabbage leaves, cold cabbage leaves, in your bra. Make sure you wear a nice, firm, well-fitted bra, and put cabbage leaves in there. Or you can use like frozen vegetables, or whatever you have, and that'll help with the soreness while you're waiting for your milk to dry up completely.
Is the cabbage leaves because of the shape of it, or is there something specific about the cabbage that helps to draw out or to
To be
reduce the
to be
milk?
honest, I'm not 100% certain why it works,
Okay.
but it works.
Right. Yeah,
um,
yeah.
yeah, it's
Everyone
you know
says you got to put the cabbage leaves on.
yeah, and
That's
it
what everyone
works.
says.
It
Yeah.
really.
Hmm.
I mean, the shape definitely helps because of the way it can, like, cup it,
Like,
in like
right,
a
right,
healthy
exactly.
way.
Right.
But I don't know if there's actually something that seeps through. I have no idea. I really can't. I'd be
Right.
lying if I told
Okay.
you.
Okay. All we know is it works, and that's all we need to know. That's
Yes,
it. Yeah.
exactly. All right. So next we have abdominal cramping. So immediately after birth, what happens is your uterus, which went from this little ball shape to now this huge baby-filled uterus, now has to go back down to its small shape. So what it does is it contracts back down. So similar to the contractions you feel during labor, you get these what they call after pains, right? Now, first-time moms typically don't feel it as strongly as women who've had more children. They say that the pain is stronger the more children that you have, or more noticeable, I should say. So we
I
definitely
felt that thing.
recommend. Oh, yeah. And it's actually stronger during breastfeeding as well, because the same
Right.
hormone that's used for the hormone that the body makes for a letdown of the milk is the same hormone that causes the contractions of the uterus. So,
Right.
but not to fear, that is a normal occurrence. You're supposed to have that, and definitely take pain medication. No one should really have to go through pain if they don't want to go through pain. Take that Motrin. That Motrin is super helpful. Okay, you don't need a narcotic. Motrin or Tylenol works just as well.
Right.
Things you can do to help this pain: you may warm baths, a heating pad, like I said, pain medication, and they also recommend deep breathing and relaxation techniques. So definitely, these are some of the things that they talk about during childbirth preparation classes. So, definitely recommend that people take those types of classes before birth, so what to expect when you're expecting one of those types of things. Then you have perineal soreness and vaginal bleeding. So, of course, the perineum is the area that's around your vagina and your anus. So it may be sore, it may be swollen, it could be bruised. Some women tear a little bit, or even the doctor may do a little cutting to help ease the passage of the baby. So sometimes, if stitches are required, they usually dissolve around 2 to 4 weeks, and the tissue heals over the next 6 weeks. Um, some ways to relieve that soreness: you could freeze a maxi pad and put in your underwear. That'll help reduce swelling, and also a warm bath or a sitz bath with Epsom salt. That definitely helps. And then we all know we got to go through some vaginal bleeding, which is different from your normal menstrual cycle. We call it lochia. And after birth, this is made up of the blood and the tissue that comes from the lining of the uterus. So basically, it starts shedding all of the extra lining that was there to help with the placenta and everything for the baby's blood circulation.
Right.
Now, it starts off as bright red, and sometimes it contains like small clots, and over time, the color will lighten and the amount will reduce. If you find that your clots are, not just like small little tiny clots, but they're like you're constantly passing these really large clots, you want to make sure your doctor knows about that, because that shouldn't be happening. So the bleeding should be waning over time, and if you see that it's consistently heavy bleeding and bright red, you want to let your doctor know, because it should be over a few days. It should go from bright red to light pink, and then from light pink to like more like a yellowish color until
Okay.
when there's none. Let's see. Also, what's very helpful with the soreness, I forgot to mention, is that little handy dandy squeezy bottle that they give you in the hospital. Take that
Yes.
home.
That's
You
a
want to
godsend
spray,
right there.
yeah, you want to spray some warm water using that on your perineum when you're urinating. It helps, especially when you have some stinging, which I'll talk about later on with some issues with urination, but it helps with the stinging and the burning in those first few days after delivery. And you want to pat the area dry instead of wiping it, because then that'll cause even more irritation.
Okay.
All right, so like I said, I'm going to talk about now the difficulties with urinary and bowel function. So it may be difficult to urinate at first because of the swelling that you may have if you had a vaginal delivery, or if you've had a catheter, whether during a vaginal delivery or even with a C-section. To decrease the stinging, like I said, you can have one of the squeeze bottles, spray some water over the area while you're urinating, and that'll help counter the stinging or burning. And also, if you have a burning sensation that lasts longer than the first few days, you want to call your doctor because you want to make sure that you don't have a urinary tract infection,
Okay.
which can happen because you have so much mixing of things going on down there. We all know it's not a pretty sight, right? It's very bloody, a lot of things going on down there. Within a couple of days, it's normal to have an increased amount of urine because the body is eliminating all that extra fluid that you've had in your body that you built up over time with the pregnancy and also during your time in the hospital. If you got a lot of fluids, you have to let all of that out. Now, when it comes to bowel movements, it may take like 2 to 3 days after birth to have your first bowel movement. And that's because you've had a lot of stretching of your abdominal muscles and, there's a lot of things going on in your body. So everything kind of has to like start getting back to normal. So you want to make sure that you prevent constipation, right? We don't want to be constipated. So you want to eat foods high in fiber. You want to drink lots and lots of water. And also you want to be active, lots of walking that helps to get your bowels moving and gets the motility going. Also, you want to try to avoid having hemorrhoids. I don't know if any of you have experienced hemorrhoids. I've had 4 children, so I've had my share, but they typically happen because of the pushing or because of the constipation. And so they can be painful, they can be itchy, they can bleed, a lot of stuff can happen. So for the comfort of those, you can use things like a frozen pad that you put directly on it. It'll help to reduce the swelling and the pressure from it. You can use Preparation H, tuck pads, and sit pads are very helpful for those as well. And you want to make sure that you avoid sitting for long periods because all that'll do is put more pressure on your bottom area, causing them to swell up even more, which will become more painful. So you want to try to avoid that as much as you can. And then you have menstrual cycle changes. So like I said, the initial bleeding that you have after birth is different from your normal menstrual cycle. So it typically takes women maybe about 2 to 3 months after birth to actually start your menstrual cycle, some before then. But if you're breastfeeding, it may even take longer, especially if you're exclusively breastfeeding, because it can delay the return of your period. And usually once you start introducing solid foods to your baby, that's normally when your period will resume. So expect that it will take some time. Now, if your lochia, which is the initial vaginal bleeding, if it went to that light yellow and then all of a sudden goes back to that bright red, that's most probably your first period returning.
Okay.
And you should expect that your cycle may not be the same like it was pre-pregnancy in the beginning because it takes time for your body to really regulate the hormones and all the changes that happened over the last 9 months. Um, let's see what else I wanted to add about that. You definitely want to make sure that if you resume sexual activity and your menstrual cycle has not yet returned, that if you are not looking to have a baby immediately, that you want to make sure that you get some birth control going, okay? Get that discussion started with your doctor, either prior to delivery or at your 6-week visit. Of course, everyone has their own idea of, when they want to have a next child. So that's definitely per the woman's choice. Okay. All right. Here's a big one, right? Sexuality, resuming sexual activity. So everyone knows, right? Like everyone always says, wait till your 6-week appointment. Doctors say wait 4 to 6 weeks before starting. And at the end of the day, there is no regulations regarding it. You don't have to wait 6 weeks if you feel comfortable enough. It's absolutely the woman's decision, right? Many couples wonder when it's safe to resume. but some couples feel comfortable to have sex again before that 6 week period comes, right? So some factors that may influence it are the type of birth you've had, you know. So if you've had a C-section, you may find it difficult to resume any types of activity, right? If you have physical discomforts that still remain, like a sore perineum or fatigue, and in general, you have this new demand of having a newborn in your house, right? It's
Right,
more
right.
difficult to actually get those kinds of things going. Um, Additionally, some things that women don't know is that if you're breastfeeding, you may have a lot of vaginal dryness because of the hormones. Um, so women have to keep that in mind that when you want to resume sexual activity, you may want to have some lubricant available to prevent, you know, any additional pain. You just went through um, this amazing experience, right, of delivering a baby. Now you don't want sexual activity to be painful and uncomfortable, right? We want to go
Right,
back to
right.
having fun,
Hmm.
for lack of better words.
Exactly. Yeah.
Also, you know, you can think about alternatives. You know, if you're not quite ready yet to resume vaginal sex, you can do other things like massage, oral sex, mutual masturbation. You know, talk with your partner, discuss what feels good and what doesn't feel good. You know, don't be afraid to open up to each other. You know, I think if anything, it brings the relationship even closer because you're able to have open communication with each other. Um, and you want, and like I said before, you want to keep in mind that pregnancy can still occur in the absence of a menstrual period. So using contraception is recommended. So, like I have there, birth control. There are many, many options that are available to us women now, as opposed to back in our mothers and grandmothers' time. You have, of course, the pulling out method, male and female condoms, spermicides. A big use now is the IUDs, right? Intrauterine contraceptive devices. They can be inserted 6 weeks after birth. So you can get it at your 6 week visit. And you have both hormonal and non hormonal methods. So this is definitely something you want to talk about with your physician before your 6 week visit so that they can have it ready for you if you want it right away.
Right.
Of course, birth control pills, and you want to make sure that you let your doctor know if you're breastfeeding because some of them may reduce your milk supply as well.
The milk. Right, right.
hmm So you have the diaphragm, the cervical cap that has to be refitted if you were using it before you were pregnant, and you have your permanent options, vasectomies and tubal ligation, or in other words, tying your tube. So you know, many different options available to women. All right, so now we have breastfeeding realities. I know that there was a question earlier in the week about breast milk supply. So first, I'd like to say that women who choose to breastfeed are always worried about whether their babies are getting enough, especially in the beginning and birth
Right,
time moms, right? So
right,
the first thing you want to
right.
do, take a deep breath, relax, trust your baby. You know, is your baby content after eating? Is your baby sleeping well? Does your baby have enough wet diapers and poopy diapers? You know, um, we use the we say that on day one you should have one wet, one poop, right? Day two, two wet and two poop. Day three, three wet and three poops, right? And then I think it's day seven you should have six, and then going forward, you know, you'll see from there. Every baby is different, of course, and you know, we don't want to like stick to a specific guideline per se, but definitely the diapers are a good indication of what's happening and if the baby is getting enough. Um,
Right.
so if all of those things are in line, then you're doing great. Don't worry about it. You're good. I know anxiety is normal, especially for first time moms, but you're doing great. So, but if you worry that you do have a low milk supply, there are a few different things that you can do, right? So, number one, you want to make sure that you nurse on demand. Whenever your baby's hungry, put the baby on the breast. Even if you feel like nothing is coming out, put that baby on the breast. What happens is
Right.
you're telling your body, listen, I need milk at this time every day. You need to make sure that you supply my body with what I need to feed my baby, right?
Right. Right.
Then you have
Right.
power pumping, and I know Lacey, you had talked about this in that post. So what you do is for like 2 to 3 days in a row, what you do is you pump after every nursing session for another like 10 to 20 minutes. So after your baby has drained your breast, right, you're going to pump even more, 10 to 20 minutes. You want to drain out everything that's in there. And once again, that's telling your body, okay, come on, I need a little more. Look, the baby's still hungry, right? So give me some more. So
Right.
that
Right.
helps.
Right.
Um, and if you're already exclusively pumping, what you can do is just pump more frequently and longer for about 2 to 3 days, and you should see an uptick in your supply. If that doesn't help, then you can do things like make lactation cookies. And many of those recipes are online and they use like fenugreek and other different things like I think brewer's yeast and wheat germ and flaxseed, all things that you can buy, whether in your supermarket or in like one of those like vitamin shops or whatever,
Right.
or Amazon, which is my favorite place to shop. And then you have mother's milk tea, which is a favorite of mine. And I know I've recommended this to like all my friends and my sister-in-law and everything, and it's always been super helpful. And that all that has is fenugreek in it, and it definitely increases your supply.
Right.
You want to also make sure that your diet is well, right? So you want to eat enough and drink enough. The more you eat and drink, the more your body can supply milk.
Right.
And one of the biggest things is getting more rest. So you don't realize that stressing yourself out and being up is like you're not giving your body time, the energy it needs to make the milk that it needs. You know, it's spending all that energy elsewhere. So you want to get more rest, and you want to make sure you offer both sides. So I know I talked about that earlier, but 15 minutes on one, 15 minutes on the other, or even a little longer if you can do it. And like I said,
Right.
if the baby does only one and doesn't want to take the second one, then pump the second one or hand express if you can. And lastly, I'll say find a lactation consultant. Like I said it before, I can't stress enough the importance of having those community members. They are super, super important. And I
Right.
think all women deserve to be seen at least once in the hospital and at least once in the postpartum period while they're home.
Right. Right. I definitely have to second that because
Hmm.
I know in the hospital I had a lactation consultant and I keep because he was my first, my first child, and I was like, what do
Hmm.
I do? And I just found like it wasn't the most helpful, even though she got me started and everything. And then once my daughter went to her first pediatrician appointment, they were like, "Oh, you're breastfeeding. We have a lactation consultant on staff. You need to go see her." And so I went to see her. I saw her probably for the first like 4 months because I kept having latching
Hmm.
issues, and she was fantastic. She always was able to get a good latch. When I got home, I couldn't get a latch, but I
Yeah.
still breastfed her. I still breastfed her for like 16 months. So
Yeah.
I
Well, it
just
worked.
yeah, it worked. It worked, and she was getting enough. And then at some point, I
Hmm.
was like, I'm not gonna pump anymore. We're just gonna go with the flow. But
Right.
I definitely, I second that. I think it's a fantastic thing. It helps you to kind of relieve your stress. I know
Hmm.
when my period came back, which was like within the second month, my milk supply tanked and I
Hmm.
was so anxious and I was like, oh my gosh, I have no milk left, this and that. So I made an appointment with her. She's like, you got a drop in there? I said, yeah, I got a few drops. She's like, you're good. Don't worry. You can still build on that. So it was just a
Right.
matter of like the hormones, going back and then
Hmm.
like the milk supply would, return. So
Hmm.
definitely they help to relieve like that anxiety and help
Yeah.
you through a lot of the problems that you
Absolutely.
have.
And
I
they
agree.
help to normalize it. You realize you're not
Yes.
the only woman that's going through this. Like, not every
Yes.
woman is gonna have like milk flowing. I remember.
Yes.
So my sister-in-law had her baby. It was like 7 months after my youngest, and I mean, when I went to assist her in the hospital, like a few hours after birth, she was already engorged. And I was so jealous because it took me so much to try to get
Yeah.
enough milk at like 3 months. And already
Yep.
at like directly after birth, she's already having to pump because she's engorged, which is
Uh-huh.
crazy to me.
Yep.
So,
Yep.
it's normal.
Yeah.
There's so many different things that I think in the postpartum world, we really have to normalize and let women know, like, you are not alone in this. Every one of us are going through this. So, that's why it's really
Yes.
important to build a
Yes.
community of moms because
Hmm.
the more
That's
you
right.
talk about it and realize that there are other women like you, then it does reduce that anxiety and stress that comes along with number one being a first time mom, number two wanting to do what's best for your baby, And
Absolutely.
even with breastfeeding, if you choose not to breastfeed, that's okay. Like as much as we promote it, it's your decision and you're not doing something to harm your
Exactly.
baby,
Right.
So I think
Exactly.
it's really good, just in general, the community and having all the resources you need to be successful in those the first year, I would say, not even just the first 6 weeks, but the first year at least.
Absolutely. Absolutely.
All right, so now I'm going to talk about the emotional realities that are associated with the postpartum period. So we know that pregnancy and the birth of a baby not only change you physically, but you can have some real emotional and social changes now that you have an addition to your family, right? So the transition to parenthood, not always easy. New parents often experience a variety of conflicting emotions. You may be happy one minute, overjoyed, and then you can be sad and stressed. You may feel energetic sometimes and then exhausted other times, right? That's all normal. After birth, we have typically baby blues, right? And that's normal. It usually occurs within like a few days after birth and should pass by about 2 weeks. So we say about 4 out of 5 mothers, which is like 80% of mothers, will have some form of this. During this time, women should really rely on their parents, their partners, family, friends, just for some additional support, right? You may need some help with housework. You may need to limit your visitors. You may just need someone to sit down and talk to just to validate your concerns. But like I said, these feelings should not last any longer than 2 weeks. And I know you said that you had a conversation a few weeks ago about postpartum depression. Um, so I won't, spend too much time on it, but we know that postpartum depression affects about like 1 in 8 new mothers. So not as rare as we think. It's actually very common. And I don't know if
Right.
anyone watches Insecure, but they definitely touched on that with Tiffany. I don't know if you watched it, Lacey, but Tiffany in the show was definitely experiencing some signs and symptoms of postpartum depression. And for a while, her friends missed it. And then finally she had that moment where she just broke and just needed to like run away for a second and just take some time to herself. And that's when everyone kind of like, oh, wait, hold on. Maybe we should have done a little bit more to assist her with this. And maybe she needed a little
Right.
bit more support.
Right. Right.
So it's definitely something that we need to normalize and understand that this is very common. 1 in 8 mothers, that's very common. These symptoms usually start about 2 to 3 weeks after childbirth, but they can begin anytime within the first year after giving birth. And if you leave it untreated, it can last a year or even more. It's important to note also that partners may experience depression or anxiety related to postpartum as well. And you may see indecisiveness, hostility, disengagement from mom and the baby. You may see alcohol and drug use increase. And for partners, the highest risk for this depression is like 3 to 6 months after the baby is born. So you want to make sure that you look out also for that. It's not just the moms, but the partners can experience it as well. So now you want to set yourself up for success, right? You need some realistic expectations now that you want to talk to your partner and other people you live with ahead of time um, to really make sure that you're ensuring the success in this initial postpartum period. So you want to focus on visitors, sleep, chores, errands, meals, childcare. For visitors, you want to make sure that you make that decision when you're ready for visitors. Everyone wants to come see mom and the baby in the hospital.
Right.
Decide if that's right for you. Decide if you want to wait a few weeks after you've gotten a routine figured out at home. I was reading something and it was funny because it said you should do is plan to be in your pajamas all day because when people come and visit and they see you in your pajamas, they won't stay as long. But if you look put together, they'll figure that, oh, we can hang out all day because she's good.
I like that idea. That's
So
so
throw some
true.
pajamas on, put your hair up in a ponytail. Don't put any makeup on,
That's right.
They're not going to stay long, trust. That was really funny when I read that.
I like that.
You also You also want to take advantage of the times that you do have visitors, right? So maybe you want to take a quick shower while they're holding your baby. Or you may even want to ask them, hey, can you just help me out a little bit and just wash up those dishes for me real quick? You know, put them to work. They're coming
Right.
to support you. There's a lot of different ways to support other than holding the baby, right?
Right.
If they're just there to hold
Exactly.
the baby, you may want to rethink having them come and visit.
Hmm.
Um, when it comes to sleep, we all know, everyone says, sleep when the baby sleeps. And a lot of times it's not very
Right.
realistic, right?
Right.
So
Right.
expect
Right.
that in the beginning you are going to have less sleep. You
Hmm.
want to try to close your eyes a little bit while the baby is sleeping if you possibly can. Um, or use the times that the baby is awake and not hungry to take a shower. So, bring the bassinet in the shower, not in the shower, in the bathroom with you while you're taking a shower.
Yes.
Because I think every mom can admit that, they've been in the shower and they can swear that they hear the baby crying and they rush out the shower and the baby is still sleeping. So,
Hmm.
bring a
Hmm.
bassinet near the door so you can actually hear if the baby is awake or not.
Right.
Try to get at least one nap in the daytime if possible, because you're going to be up frequently throughout the night, right? It's a dream to expect that a baby is going to sleep, through the night. It's
Right.
not going to happen in the first few weeks, that's for sure.
Hmm.
And some people don't get the actual full night, even up to like a year. Some people don't get
Hmm.
that. So
Hmm.
you want to be realistic about what sleep is going to be like for you.
Right.
I talked about chores, right? You want to allow friends and relatives to help with your housework, with cooking and other chores. But you also want to set the realistic expectation that not every chore is going to be done. And that's okay. You have to know which chores need to be prioritized. Okay. So, for example, you're going to have visitors. So maybe you want to make sure that the living room is always clean, right? Whichever is the first room in the house that people are going to see. Don't worry about the bedrooms. Don't worry about, the areas that people are not going to see.
Right.
Prioritize.
Right.
You can't, I mean, for me anyway, I knew there was no way my entire house was going to be clean,
Hmm.
right? Especially by the time I had my fourth kid, like I
Hmm.
have three older kids, it's not going to happen, right?
Yeah.
Unless they're going
Yeah.
to be doing it. And I have teenagers, they're not going to be doing any chores. So you definitely want to have realistic expectations with that.
Hmm. Hmm.
Errands, you want to try to stock up before the baby arrives. So go to places like
Right.
BJ's or Costco and buy in bulk. Um, Also, what you could do is if you know that you have a visitor coming, you could say, hey, can you stop off and get me XYZ? Um, Most times people really want to do whatever it is that they can do to help, and they
Hmm.
don't know how. They don't know what best, to do. So if you give them a little errand to run, they'll do it. 9 times out of 10, I think that people will say, oh, of course, absolutely. So you want to definitely rely on friends and family as well and
I
ask for
just want
favors.
I wanted to just say
Hmm.
one of my friends, she had her son before I had my daughter, and she did
Hmm.
meal prep. She prepped all her meals before she went in to have her son, and she put everything in the freezer just in case, like if nobody brought anything over, those type of things. So all
Hmm.
she had to do was just pull things out of the freezer and then just cook it up, and then they had food. So I thought that
Yep.
was a good idea on her, and I said, "Oh, next time I'll make sure that I do that because I did not do that." And I was like, "Is somebody gonna come with food? Like, what are we gonna do? Who's cooking? Like, what's
Right.
going on? I can't cook right now. I had
Right.
a C-section. I can't lift
Right.
nothing. It's just like so much drama." But yeah, I thought that was a
Right.
really good idea.
Right. Right. So that was the next thing. So meals,
Hmm.
absolutely. Prepare beforehand. Get
Hmm.
that Tupperware going. Fill up your freezer. Like you said, because you're not gonna have the time to cook. It's having a newborn is so demanding. You
Hmm.
know, and you don't want to leave them too. I mean, even when they're not
Right.
crying, you just literally are sitting there holding them, looking in their face.
Hmm.
When you could be
Hmm.
doing other things, you're holding your baby, and
Yes.
that's okay.
Yes. Hmm.
But you want to make sure that you're still being fed, right? Because you want to make sure you have a healthy diet as well, especially if you're
Hmm.
breastfeeding, because you want to keep your supply
Hmm.
going. And
Right.
in order to
Right.
heal, your body needs adequate nutrition. So
Hmm.
you absolutely want to do what you can in that sense. And when
Right.
it comes to childcare, you want to make sure that you arrange something if you have older children in the house, right? So
Hmm.
now you're going to be so focused on this newborn that, your older children are going to need some help too. So when I had my third kid, I now had three children under the age of 4. Now
Hmm.
that's tough, right? The older two had to go to daycare,
Mhm.
And so what I did was I had my brother-in-law, he would come pick the kids up for me. I would get them ready, but he would pick the kids up, drop them off at daycare, and then my husband would pick the kids up on the way home from work.
Right.
So, you want
Right.
to make sure that you have a system in place beforehand. Because
Mhm.
once you've delivered this baby and you have this newborn at home, your mind becomes like mush. Like you're like zoomed in on you and the baby, and it's hard to like kind of get things in place at that
Mhm.
time. So just to alleviate some of that stress
Right.
off of
Right.
you, get this done beforehand. Um, and also, if
Mhm.
you have older children, you want to try to set aside some time where maybe your partner can be watching the baby and you spend some time with your older children, because sometimes they can feel a little left
Right.
out. You want to make
Mhm.
sure that you include them in certain, age appropriate activities with the baby. So maybe they can help with
Mhm.
diaper changing or feeding. They always love, sitting there holding the baby. Maybe you want to pump a little bit into a bottle so that they can do the feeding this time. That way they feel involved and they
Right.
feel a part of this process of this new baby in the house. This baby is their
Right.
baby
Right. Right.
too, you know
Mhm.
it helps
Right.
to, try to curb the resentment a little bit. All children kind of go
Mhm.
through that stage, but, if you can do something to help it a little bit, that's some of the options you can do.
Right.
But overall, I would say that the best advice I could give is to be flexible. Just like
Mhm.
with pregnancy, each birth, each baby, each transition home is different.
Mhm.
What happens with my first was different for my second, was different for my third, was different for my fourth.
Mhm.
If you go in expecting that it's going to be the same each time, you're going to be highly disappointed and unprepared. And you don't want to do that, right? Realistic
Right. Right.
expectations.
Mhm.
Um, be kind to yourself. It takes time to get to know your baby. It takes time to figure out a routine. It takes time to figure out parenting in general. My
Mhm.
oldest will be 16 this year, and I'm still trying to figure out this teenage life. My 5-year old, I've got that covered. I've done that 3 times already. But
Yeah.
with my 16-year-old, I don't know nothing about this age.
Yeah.
So be kind to yourself. It's
Mhm.
okay not to know. It's okay to kind of feel like you're figuring it out as you're going along. That's
Mhm.
normal. It's okay. Get a
Right.
support group. Like I love the idea that Lacey brought up to really empower moms and to bring
Mhm.
together women and to have these topics discussed. Because sometimes women are just afraid to even bring up the conversation.
Right.
We talk
Right.
about everything. I know that there was a whole conversation about that postpartum ad. Was it for the Super Bowl or I forgot what it was? And it was banned from
Yeah.
TV because it was just too
Mhm.
real, right? And any woman
Mhm.
that's had a baby knows how real that ad was, that
Right.
putting
Right.
the baby down and having to run to the bathroom and the whole using the squeeze bottle and the big pads that you have to put on.
Mhm.
And it's like the world is not ready to discuss these realistic expectations. It's
Mhm.
it's normal. It's a part of life. Like, why can't
Right.
we talk about this?
Right.
So
Exactly. Exactly.
definitely some of the things that I get concerned with, especially as a labor nurse, and that's why I spend a lot of time when I'm talking to the women that, pass through my unit in really what to expect when they're going home and before going home, how to get, a few things in place at home
Mhm.
prior to leaving the hospital because once they left the hospital, it's kind of like they're on their own with their family.
Right.
I'm
Right.
not there to help you, which is one of the things that we're really trying to get going is having home visits approved for
Mhm.
insurances. Like they should really have that option. Why do you have to go into your
Yeah.
doctor's office?
Right.
You know,
Right.
a few days
Right.
after or even a week postpartum, somebody should be able to come in and visit and just make sure that everything is okay. And if you need like, some advice or whatever, some support to help you
Exactly.
to transition better. So
Exactly. Exactly.
definitely something that, we're working on as, practitioners in the field.
Mhm. Mhm.
All right. And lastly, the hot topic, right? Healthy weight after pregnancy and
Mhm.
postpartum fitness, right? So everyone wants to have the snapback. It doesn't happen with everyone. I mean, don't follow
It
these
happened.
celebrities. Don't follow these celebrities. It was funny. I was looking at, I think Cardi B posted a video the other day of her walking in like a bikini And she walked through and her stomach was like absolutely flat. And then she like poked it back out. Like I guess she was like holding it in. And it's like, don't let these pictures fool you. Everyone goes
Yeah.
through some sort of PUD. And we all don't
Right.
have, surgeons who will be a little extra kind and take out, that little extra flab. It is what it is, right? We're gonna walk around with a
Exactly.
little bit of extra
Exactly.
weight. That's normal, guys. In reality, most women, it takes several months for you to lose what you call like, baby weight.
Hmm.
So what you should expect is immediately after the baby's born, you're gonna probably go down to the size you were at about like 6 to 7 months pregnant. And you should not use this time to go on a restrictive diet. You want to make sure that you focus on eating healthy and physical activity, right? But your physical activity should not be severe or like, not even moderate to start. You want to start off with mild. Start off with some
Hmm.
walking around your
Right.
block, getting yourself kind of, especially if you weren't doing any type of exercise during your pregnancy, right?
Hmm.
A lot of women like they decide to take on these extreme hit workouts and they didn't do anything during the pregnancy. You're
Hmm.
gonna wear yourself out and you may actually do more harm than good. So you want to make sure that you take the time, listen to your body, what your body needs. So like after a normal vaginal delivery, you want to start slow to moderate walking when you feel ready. You want to wait to start exercising, especially with abdominal exercising. You may want to wait like about 2 to 4 weeks after delivery for ab workouts. One of the things that we are concerned about is, I'd never say this word right, diastasis recti. I don't
Hmm.
know if you've heard of that. So that's when you have a
Yes,
separation in the abdominal
I had
muscles.
that. I had that. Yep. Hmm.
So
Yeah.
you want to make sure that your doctor checks if you have a separation. And then, depending on that, because you may have to wear an abdominal binder to try to help close it up a little bit. It takes time.
Hmm.
Um, let's see. Oh, with the eating, I forgot to mention. So I have their website. So the USDA has a site that can help you plan your eating. It's called the My Plate Plan, and you can put in whether you're breastfeeding exclusively or occasionally. You can put whether you're not breastfeeding at all.
Hmm.
And then it helps to kind of help you choose how much on your plate you should have. So, like for
Oh,
example, with
nice.
grains and vegetables and what type of protein, all that kind of stuff. So
Hmm.
definitely a helpful website to use
Hmm.
postpartum. A lot of people don't realize that eating is really important when it comes to just healing in general, and you have a lot of healing that needs to go on when you
Right.
have
Right.
even a vaginal delivery or a C-section, a
Hmm.
lot of healing needs to go on. Um, I think people, I mean, yes, it's a normal thing to have a baby, but it's still, very hectic on the body. It's very rough on the body. You want to make sure that you're giving your body all the tools it needs to really be in a place to get back to its pre-pregnancy state. Um, yeah,
Right. Right.
and I think that was it. Oh, so to some of the areas to focus on with postpartum fitness, you want to focus on regaining muscle tone in your pelvic floor muscles
Hmm.
and, like I said before, your core abdominal muscles, right? Because of
Hmm.
all the stretching. So for
Right.
the pelvic floor muscles, you want to work on like Kegel exercises, right? I'm doing one right now, right?
Hmm. Me
You should
too. Me
try to
too.
try to get you want to do a lot. I think they said like 100 a day or something like that.
Hmm.
So anytime you remember to do them, just do like a bunch
Hmm.
at a time, and that way it'll kind of get that tone going again and firm it back up. And
Exactly.
for ab exercises, there are a million different ones you can do. You have sit ups, crunches. There's a lot that you can do.
Hmm.
Easy to Google, easy to find on YouTube, free ones. You don't
Yeah.
have to go to a gym and use a machine. Easy to do at home. Lay on the floor on a flat, firm surface and get some stuff going.
Right. Some
Um,
planks, side planks, those type of
Right.
things.
Yeah.
They
There's a
help too.
there's
Yep.
so many different things here, and like I said, you want to start small and then go higher. You don't want to start big and then be like, oh my God, I can't do
Yeah.
this
No.
ever.
Then you're not gonna want to do it if you
Yeah.
start big. You're
Exactly.
gonna be like, you know what? I'm done. I'm just gonna sit down.
Exactly. Exactly. Exactly.
Absolutely, I
Um.
agree. Hmm.
Yeah, so and then you want to do things like maybe like mom and baby yoga, walking
Mhm.
and running with a baby stroller, like I said, online exercise videos, and for other women who are used to going to the gym and know what machines to use, etc., you can always go to the gym. But
Mhm.
it's not mandatory that that's the only place that you can work out. We know that we can do it anywhere. So
Right. Exactly.
yeah, but that's it. Thank you so much.
Oh, thanks, Alicia. That was amazing. Thank you. Thank you
You're
so much.
welcome.
I know that everyone in the group and on YouTube, wherever people are watching, are going to love it because a lot of women, like you said, don't want to ask certain questions and
Mhm,
or maybe don't know the type of questions to ask. So
mhm,
I'm sure you've covered the gamut of things that people would want to ask, and I'm so thankful that you're in the group and thankful that we have you here to talk with us because you definitely
mhm,
have so much experience, with being a mom and then also working in labor and
mhm,
delivery, and now,
mhm,
going into being a midwife,
mhm.
which is fantastic. I can't wait to hear your story when you graduate.
Yes.
I'll be so excited. I'll be doing a dance too with you. Okay, so, so if
Yes.
anyone want, if anybody wanted to contact you, how can they go
Mhm.
about contacting you?
Okay, so you can email me my first initial A, last name Faulkner, FALCONERRM at gmail.com. You can find me on the Facebook group. I'm in there. I think Lacey had tagged me to the flyer, so you could find me in there. Um, I'm reachable. I'm pretty quick with social media. I'm probably better at social media than I am at answering phone calls. So,
Yeah, me
but
too.
email, email or Facebook really is probably the better way. I don't mind. I will answer any questions you may have, and if I don't know the answers, I'll find the answer and then get back to you. But this is really a passion of mine. I really enjoy what I do. I can't wait to be able to provide services to women as a practitioner versus, being just, I don't want to say just a nurse, but, when I'm under specific guidelines that I have to follow versus being a sole practitioner and being able
Right.
to be more autonomous, right, in my
Yes.
practice. And,
Yes.
the midwifery model of care is very different from the medical model of care. So, I'm really excited about being able to branch out into that area. So,
I would
but yes.
love, I'm sorry to interrupt. I would love
Mhm,
for you to come back once you're done and complete
mhm,
to talk about, because I'm sure some people don't know what a midwife is or what a
mhm,
midwife does. Maybe they've never heard of it or
mhm.
heard of the profession. So I would love to have you come back and speak about that, just to kind of, give us some information about what you do, why it's
Absolutely.
important to
Absolutely.
have you, or any, midwife. I
Mhm,
think it's just an important thing because I started going to midwives myself, because
mhm.
I won't go into the details, but
Yeah.
I can completely appreciate and I love what you guys do. So
Mhm.
that's it on my end. So if you guys have any
Yeah.
questions, you can, ask them. I'll post
Mhm,
this on YouTube. We'll post this in the group on Facebook. If anyone's on YouTube and they would like to join the group, we're under Jubilee Mama Empowerment, Jubilee Mama Empowerment. Spaces between the words. We're on Facebook. You can always join us there. Make sure you answer all the questions too before that. And if you have questions, you can either post there or you can, like Alicia had given her information, you can ask her directly if you don't want to go through the group or go through me. That's fine. Definitely, completely, you
Absolutely.
can ask her.
Mhm,
Okay, so I think that's it. Alicia, I want to thank you
mhm.
so much for coming on. I
Thank you,
appreciate it.
Lacey.
I'm so happy, and I can't wait to have you back. And good to see you guys. You don't know, I
You
haven't
too.
seen her face since undergraduate. So what did you say? 18 years?
18 years. Oh
So
my
this
God,
is
it goes
this is a
by.
reunion of sorts. So like a
And
virtual
we were
reunion.
and we were only two, right? We were only
Yeah,
two.
exactly. We're only 2 years old. I wish I could say that. I hope I look young. I hope I look okay in these
Me
videos.
too.
So that's it. So thank you again so much. And then like I
You're
said, I would love to
welcome.
have you back and talk to us again. Okay?
Absolutely.
All
Thank
right. All right. God
you.
bless you
Bye,
guys. God bless.
everyone.
Bye. All right.